Our next segment is the path of patient engagement. In this fireside chat, Randy Rutta, CEO of the National Health Council, will join Dr. Nakela Cook, Executive Director of the Patient-Centered Outcomes Research Institute, or PCORI, in a discussion about what patient engagement means and how PCORI has been leading the way over the last dozen years. Randy, over to you.
Nakela, it is terrific to be with you here today. The sub-theme for today's National Health Research Forum is starting with the patient. That focus is certainly germane to PCORI's mission and its impact. And as someone who's been a long-time advocate for and oftentimes partner with PCORI, I'm pleased to recognize that PCORI is coming up, I believe, on an impressive milestone, 12 years since authorization. Congratulations.
Well, thank you so much, Randy. And it's such a pleasure to be here with you today. And indeed, this Friday, September 23rd, marks PCORI's 12th birthday. So we're very excited about that at PCORI.
That is terrific. So then let's talk about how PCORI has changed the path of patient engagement over the course of those dozen years. What can you tell me?
Well, PCORI has indeed changed the path of engagement over the now 12 years since our initial authorization. And if you think about it, PCORI was established by Congress to meet an unmet need. There was already a recognition that despite the wealth of health research that was underway, that patients and caregivers and other stakeholders often didn't have the information that they needed to help guide healthcare decision-making, those types of decisions that they faced every day. And so there was a stronger focus that was built into thinking about PCORI, and the name says a lot. The Patient-Centered Outcomes Research Institute has a strong focus on patients. And our legislative mandate was translated by the PCORI Board of Governors to really put that focus on patient-centeredness in some very important ways in the organization, making it essentially part of the criteria for funding from PCORI. And the research questions and outcomes of our studies must be of importance to patients first and foremost, and those who care for them, but they also must engage patients and stakeholders as partners in the research process. And this has certainly been something that has influenced the conduct of research even beyond PCORI. We really can't get to true patient-centeredness without engaging and centering on patients and the patient voices, their perspectives, and their priorities. So engagement's really at the heart of what we do at PCORI and at the heart of our mission. And when you think about engagement, we define it as the art and the science of robustly bringing together and meaningfully integrating the variety of perspectives from across the research enterprise that need to be involved to really make the evidence that is produced from PCORI-funded research useful to patients, useful to caregivers, clinicians, and really the broader healthcare community. So we see patients and stakeholders engaged as partners at every step of the work that we fund and the work that we do as a funder. They serve on advisory panels and help us determine what projects and research topics we'll focus on. They participate in our merit review process and determine which projects ultimately will be funded. They participate in peer review of the draft final research reports that are then posted on the PCORI website and help us to understand and our investigators and authors to gain a critical perspective and nuance about the results from the funded research. They also participate in the dissemination and implementation of findings to help us translate and communicate research results in real-world settings. And they also help us with integrating findings into clinical practice and policy. So engagement is just center to everything that we do at PCORI, and patients and caregivers, as well as the broader stakeholder community, are those that we feel are really important to engage in PCORI's work. And I certainly can tell you a great deal about what we've also learned about engagement since PCORI's early days. And we've tried to make the most of what we call a natural laboratory by studying engagement in every aspect of the work that we do. And so we've learned about how to engage individuals and organizations, how to better support our applicants and awardees in doing this type of engaged research, and to answer questions about what happens when you engage patients and other stakeholders in research. We gather data from across our project reports, from externally led studies and evaluations, and also from the practice-based experience of PCORI's engagement officers who provide real-time consultative guidance and technical assistance to PCORI-funded study teams. We've recently also launched a Science of Engagement initiative to learn more and create more of an evidence base on engagement in research, where we're really trying to understand how engagement actually is done most effectively for individuals and for communities and measure better engagement in research. One of the things I may mention is that through a qualitative study that we conducted a few years ago to assess really the influence of engagement of patients and others on PCORI-funded studies, we actually found that there were a significant number of examples of influence by patients and stakeholders on research studies across areas such as the design of a study. We've learned that engagement actually can help evolve the scope and the aims of a study, the outcomes and measures of a study, and even the selection of the design of the intervention. Engagement also has helped in terms of thinking about the content and design of intervention tools and recruitment and training materials. And this can really matter to patients because it makes it more effective ways in terms of providing helpful written materials that are more user-friendly and particularly for certain audiences that we're trying to reach in our research studies. And we've also learned that helping researchers to really conduct engagement in the PCORI-funded research allows them to understand the real world and end user experiences and realities and circumstances of patients and those who care for them, and how to best involve them in the research that they're conducting. So we certainly have seen over the last 12 years a remarkable pace of progress when we think about patient-centered research and engagement in research, and what we've done in terms of learning about that engagement in research to really influence a number of aspects of the way that research is conducted.
That is so impressive. I mean, you're so incredibly articulate, but everything that you laid out, so comprehensive, so thoughtful. And I know the PCORI journey is a learning journey, so this model continues to become enriched at every step. So in your view, what would you say is the gold standard for patient engagement? Because what you just described sounds awfully good.
Well, when we think about gold standard around engaging patients and caregivers especially, but also the broader healthcare community relevant to any particular topic, gold standard to us means that they're all engaged as true partners in the research enterprise, true partners to the investigators all the way through the research process, from the design of the study through to the dissemination of results. And when I say true partners in research, it goes well beyond just patients as participants in a study or in a study cohort, or the way in which you may think about checking certain boxes to make sure that they're validating the aims of a study. True engagement as partner is an active and meaningful and respectful and equitable engagement amongst the scientists, patients, and other stakeholders. So it's really much more like a team activity, where all the members of the team have valuable skills and experience and expertise and insight and are recognized as such. And one of the ways that we help ensure that this is the case is through appropriate training of all the parties to help them work more effectively together. And one example of this is that we've developed a resource that's called Building Effective Multi-Stakeholder Research Teams. And it provides basically modules to help research teams work together as productive teammates and to help all the team members be active participants. But we've also developed things like Research Fundamentals, which is a course that can be accessed online on our website to help those who are interested in learning about research and the research process and how to become involved in patient-centered outcomes research. And that's available to the public so that we can start to build the capacity that's necessary for all stakeholders to be part of the research team. But we recognize that building new skills and for investigators and patients and stakeholders really requires bandwidth, and it often requires funding. And so we offer some competitive awards through what we call our engagement awards that support the building of this type of capacity and skill set. And it's an opportunity to get involved with understanding engagement and preparation for thinking about patient-centered outcomes research projects that PCORI may fund. I think one of the summaries of the benefits of engagement related to all the stakeholders in the research enterprise comes from some reviews that we've done related to PCORI's work. And we've learned that for patients and stakeholders, that they really garner an increased knowledge about and enthusiasm for the research. But they also build new and better relationships with researchers and stakeholders. And communities that are engaged in patient-centered outcomes research find that the keys were that they were building trust and increased awareness of different stakeholder perspectives through this type of engaged research. And for researchers, they've really benefited from a deeper understanding of the concerns and the needs of those who experience and care for the conditions that are being studied. And this really helps to ensure that their evidence results are useful to those that matter the most. So those are some of the key things that we've just been thinking about as we talk about gold standards for patient engagement.
Wow, that is absolutely great. And thank you for making that distinction because it's really important and rich. Let me talk a little bit now about your current strategic plan, which I know highlights creating an inclusive culture through meaningful engagements with patients, caregivers, with other stakeholders across all aspects of research. Could you tell us a bit more about this part of your framework and how do you work to create an inclusive culture and then share it? That would be of real interest, I think.
We're very excited about our new strategic plan, and it does include a strong focus on inclusivity and diversity, equity, and inclusion more broadly. And through a lot of our recent strategic planning activities, we heard really loud and clear from stakeholders across the gamut really for PCORI, the need to broaden and diversify the communities that participate in health research, as well as to promote the use of evidence that's generated by PCORI-funded studies to improve the outcomes for patients that may have been traditionally marginalized by the healthcare system or even historically excluded from research. And we stated this goal very clearly in the language that you find in our strategic plan and one of our national priorities for health that is simply stated, achieve health equity. And it's a priority for health that is not just standalone, but also embedded and interwoven into all the other national priorities for health that are included in the plan. But as you think about creating a more inclusive culture around research and clinical research, I think it's really critical to the goal of achieving health equity. And I'm sure you're aware that there's just this growing body of evidence that our clinical trials just do not represent the demographics of this nation. And so in doing so, we really risk a research enterprise that produces evidence that's derived from study cohorts that are just not representative of the patients that we traditionally encounter in clinical practice. And that really is just unacceptable if we want to improve the clinical care for the patients that we aim to serve. And so we must and really can do better. And PCORI is looking to do its part in this. And for our part, we are continuing our top to bottom examination really of how we do our work as an employer, as a business, and as a funder as well. And we recognize that achieving health equity really requires a holistic approach, one that recognizes opportunities that surround each of our organizations and each of us as individuals. And so it's going to require a collective opportunity here. And achieving health equity, we think requires engagement of those communities that have been historically excluded or historically mistreated, or communities who may have well-founded mistrust of the research and healthcare enterprise. And this type of approach to engaging these communities is going to require a lot of humility, transparency, and really an openness to co-creating solutions. And so PCORI has stood by many principles throughout its first dozen years, really. And there are also principles that we think are applicable to how we want to address the questions, the concerns, the evidence needs for really all communities. And so we think we can apply a lot of what we've learned over the last 12 years to help us move forward in this inclusive approach to research, to the research enterprise. And the principles are really important, but as a funder, there are also a lot of opportunities for us explicitly. And we explicitly solicit applications that aim to address disparities as well as focus on populations that have been experiencing years and decades of disparities and inequalities in this country. We also have a focus on seeking applications that advance the evidence to achieve health equity as articulated in our new national priority for health. And we work to think about how we empanel merit reviewers and peer reviewers to really ensure our panels reflect the diversity of the country that we serve. And we fund a lot of community-driven projects that help support capacity for those communities to really drive and partner in research with us. But there's so much more we can do, and we look forward to working with you and the National Health Council and Research America and really all of our stakeholders as we address really this critical imperative of our time. And we can't do this alone. And that's why we think this is an opportunity for collective action to really think about the inclusivity in research that will drive toward equity.
Again, very impressive. Your approach is so aligned with really our vision, our aspirations at the National Health Council and Research America for true patient engagement. And just hearing you discuss what you're currently doing, it's transformative. And so thank you so much for that. And you're doing it at a challenging time. Since you started your position as Executive Director of PCORI in the early stages of the COVID-19 crisis, how has the pandemic affected PCORI's thinking on how to best engage patients in such a challenging and changing environment?
Well, it certainly was an interesting time to begin a new job, to say the least. But I couldn't have ended up in a better place working with PCORI and all of its stakeholders. But the COVID-19 pandemic certainly has affected PCORI's work in many, many ways. And it's given what I think is a new breath of urgency to our longstanding focus on health equity. As we saw the disproportionate impact of COVID-19 on certain populations in this country. And the pandemic's also strengthened our focus on specific topics related to healthcare delivery, such as telehealth, for example. During the pandemic, we saw telehealth come to the fore very quickly, and we were fortunate that PCORI had focused on telehealth as a care delivery option even prior to the pandemic. But we commissioned a landscape review on telehealth to summarize how some of the payment, regulatory, and delivery systems have changed for telehealth during the coronavirus pandemic, and also to just better understand how changes in the delivery system during COVID-19 might change our focus on telehealth research. We have also funded about 119 comparative clinical effectiveness research studies that answer questions on how well telehealth works for different populations under various circumstances. And over 80 of these studies include people who identify in racial or ethnic non-white groups. And at least 33 of PCORI-funded research studies that focus on telehealth have focused on things such as mental and behavioral health, really important clinical care problems that were, I think, really on truly kind of affected by the pandemic. And the pandemic also strengthened our approach on thinking about our new national priorities for health as we were developing our strategic plan during this time for the several years to come. And there's, I think, a growing focus in that strategic plan on the issues of health that surround an individual and not just health care. So thinking about the important influencers and drivers of health and the important cross-sector collaborations that are going to be necessary for us really to make a difference in improving the health of individuals and populations. And so the pandemic itself really has shaped a number of things with PCORI's work, but all, I think, in a way that helped us really uncover through, I think, this unprecedented stress test we've all experienced over the last several years, several areas of needed focus for patient-centered research as we move forward.
That makes so much sense. Your focus on telehealth, really, I think we're just beginning to learn how across the health ecosystem some of those lessons can benefit access to patients in a way that's meaningful to them. And throughout what you just described, I get that sense of wholeness, the holistic nature of both the health environment that patients find themselves and then their own health and their health journey. And I just love what you're describing as your approach of PCORI, really putting that patient at the center of and involved in how their health is addressed. Let me ask you about disparities. Combating health disparities has been prominent throughout your career, I know. Tell us how the focus on patient engagement in diverse populations occurs, and how can we all have a role in ensuring that broad access to participate in research really does cut across and through those disparities that exist and or have existed.
I have had a very longstanding interest in tackling the health disparities issues in this country really since I was a child growing up in the stroke belt in the South and Southeast. And witnessing what really I later to come to understand as health disparities. At the time, I really didn't know what to express I was seeing in my neighborhoods and communities. And this has been a major factor in thinking about my career as a health services researcher that really focused on the disproportionate outcomes that were witnessed by certain populations in this country. And I joined PCORI really in 2020 because its mission is so well aligned with my personal and professional vision to promote excellence in health and healthcare in a manner that's both patient-centered as well as empowers all parties to contribute toward our shared goals. And there's a part of your question that I think is worth digging into and building on a little bit. I agree that the research enterprise certainly needs to do a better job of providing entree to historically excluded communities. And there are mechanisms, resources, and opportunities that we can put in place. And many of these I'll refer back to that I mentioned earlier, and PCORI's put several of them in place and continues to work around issues such as training for patients and community members and to be partners and true and equitable partners in research. But it's not going to be enough for us to just think about the research community and participating in research. That's just not sufficient. And you can provide excellent access through a robust recruitment strategy, but if the question and the outcomes and the overall approach don't really engage those members of the community and those that you're really trying to reach, and it's not resonant with them or relevant to them, then you're not going to get the participation that is really the goal for patient-centered and engaged research. And so we have to recognize that no small part of that is going to come from overcoming that. There's a big part of this that is related to overcoming lack of trust in research, and we really have to humble ourselves as well as our approach and think about the way in which we want to engage with communities and community leaders. And I'd also note that community really is much more of a fluid term. It can encompass geographic, but also racial and ethnic and other demographic populations. And if we truly want to have an approach to research that's reaching diverse populations, then we're going to have to engage in ways that really help that population bring to us the most important areas of focus, how to engage effectively so that they're integral as equal partners in the research enterprise.
Boy, that's so well stated. And that's not a natural way in which healthcare has traditionally operated. It's been much more, you come to us. And I love what you're saying about community as the patient defines it, as they experience it, and it speaks to their own lives and their journey toward health. Hearing you talk about how you put that right up front and center is so key. You mentioned digging in on my previous question. I like that. May I flip it a little bit and ask you to dig in a bit more on trust? You mentioned trust, and I would imagine that this is a key factor among many of the significant barriers to ensuring a robust patient engagement experience.
Well, certainly trust is one of the bigger barriers to effective engagement of all patients and stakeholders. And members of communities that have been either traditionally or historically marginalized or excluded from health research, or who have really good historical reasons not to trust researchers or healthcare institutions are likely not to have a high level of trust in research and in researchers. And it takes time, it takes effort, it takes patience to really overcome this barrier. And building that trust means being seen as trustworthy, which also means that you share the values and concerns of the communities that you're hoping to engage in research. And we have certainly seen a number of common challenges that have been shared with us by some of the principal investigators in the research that we funded and by patients and stakeholders. And they really started to fall into four main categories. One relates to infrastructure and resources, including the need for things such as trainings, as well as having funding and staff resources for engagement to really compensate partners. And time is always a challenge. We hear from patients and stakeholders and investigators that they lead complex and busy lives, and they have family responsibilities or illnesses and other demands on their time as they're trying to also meaningfully contribute to research. So we really have to think about how we overcome that type of barrier when we're working with communities and individuals. And we've also heard another category related to really a common challenge in this type of engaged research, and it relates to people and teams. And when you're conducting engaged research, it's really a multi-stakeholder enterprise, and it's going to involve integrating stakeholders with different and specific perspectives and interests that may differ from those of the trained comparative effectiveness research kind of researchers. And everyone has their differing and own perspectives and interests, and the need to balance all of these perspectives and interests can also be quite challenging. And another challenge is in recruiting the participants that we've just talked about who truly represent the diversity of individuals whose conditions, with the conditions and circumstances that we're trying to study. And so this type of thing related to teams as well as people that's a really important thing for us to think about as we're trying to overcome challenges for engaging in research. Another area that we often hear about challenges relates to organizational barriers, which can really be challenging for a lot of the PCORI-funded investigator teams. And a good example is that a lot of our institutional review boards, or IRBs, have not always understood what we mean when we talk about engaged patient and stakeholder research, and that it's fundamentally different from just participating in research. And investigators also run into challenges all the time in terms of finding the time and flexibility to really maximize the input from their engaged partners on their funding projects. And finally, probably one of the greatest challenges we hear about is in balancing views and priorities. For example, in randomized controlled trials, this can often be seen as kind of the gold standard for clinical research, the type of study that really influences guidelines in clinical practice. But it can also be viewed as an unfair or unjust approach by some patients and community members, and they may not be always willing to participate or concerned about participating in these types of randomized trials. And so we have to really engage with the individuals and communities to understand how to best to design these in ways that make sense for the community and participants that we hope to engage in the work. So it's not just patients who can have different concerns or differing views. Sometimes clinicians don't always agree about whether or not there's true equipoise in a clinical trial. So these are the types of things that we really have to overcome when we start to think about how do we engage effectively in order to really kind of get beyond some of the issues that may be, I guess, challenging in terms of overcoming these challenges for patient-centered engaged research.
I think that's so well said, and that the systems are still learning that exist around both patients and around the researchers. And to have PCORI take the approach that it's taking means that you're breaking down those barriers through education, through outreach, by example. I mean, it really is terrific, because that's where we will ultimately get collectively to where we need to be to truly understand and support patients in their care, in their health and well-being. So thank you for that. But what if there are patients out there who want to get involved in research? How can they find out about participating? I hear from researchers so often about how they can best, achieve their goals through outreach, and really bear the burden of trying to make sure that they found the right patients to really give them that holistic view that you described. What if there are patients out there that say, I've heard of this PCORI, or I understand there's research happening? How can they find you, and how can they find these research programs?
Well, we certainly have many ways for patients and other stakeholders to get involved with PCORI, and it could be helpful for not only patients, but also those who may want to be engaged in research that PCORI funds in other ways, and really all research. One is an ambassador program, and this program really aims to help patients and organizations, as well as other stakeholders, participate in sharing our vision and mission with their communities and participate as full partners in research and really help with the ensuring the sharing and use of the information that's garnered from PCORI-funded research. We also have advisory panels, and our advisory panels have members that are representatives from across the medical and healthcare community who help us advance our scientific and engagement work, and we periodically issue new calls for new members. And we welcome the broader healthcare community to get engaged with our advisory panel work. We have a merit reviewer program with both professional researchers and lay stakeholders who can be reviewers of research applications that are submitted in response to our funding announcements. And that's another way that people can be involved with the work that PCORI does. And we're not the only organization in the research enterprise, and certainly there's no single pathway, but I'd encourage patients to look toward organizations that represent their community, however they define community, as you've mentioned, and at the national, state, and local level. And there are many resources out there. But I'd also encourage those organizations and everyone really in the research funding enterprise to look continuously at our approaches. Are we creating those open and no wrong door approaches for patients to participate in the research enterprise as equal partners in that participation?
In my experience, you can answer that last question as a yes. I mean, you absolutely are demonstrating a no wrong door approach, but collectively, how can we really get behind that? I do have one last question for you, and you've been so generous in explaining the amazing body of work that PCORI is carrying out under the strategic plan. But what's your vision for PCORI going forward?
Well, it really is laid out in our strategic plan, and we have learned a lot from stakeholders over the last few years as we've engaged in order to create this vision for the next several years coming forward. And specifically, our strategic plan encompasses 5 new national priorities for health that I think state the goals for the organization quite well. But maybe just a couple of quick overarching points. This strategic plan, I think, represents a really bold vision for PCORI. It is a natural evolution of PCORI's growth and is really an inspirational roadmap for how PCORI will continue to pursue its mission. The patient-centered focus in the plan really positions us well to be innovative in the way that we think about how we are moving forward on this vision over the next several years. And the interconnected goals and the national priorities for health are going to capitalize on emerging research opportunities. We also are excited about the plan being centered on these 5 long-term interconnected goals that focus on improving health outcomes, not just healthcare outcomes, but health outcomes. And so it really will guide our work across our comparative effectiveness research that we fund, our engagement, dissemination, and implementation activities, and the research infrastructure activities that enable that research to take place. I hope that you all will take a look at those 5 national priorities for health because they address things like key influencers and drivers of health, as well as that unique intersection of healthcare and health research that considers the many factors that really contribute to the complex realities of patients' lives across all the arenas in which they live, work, learn, and play. You'll find our plan also has this redoubling of our efforts to really achieve health equity through the work that is funded at PCORI and increase our understanding of the factors that lead to perpetuate health inequities. We think that this plan is overall responsive to the healthcare landscape, but is a living plan that we anticipate we will evaluate regularly and monitor the evolving needs for patient-centered research and implementation strategies in order to make sure that we're continually responsive to the landscape and healthcare landscape that PCORI was really called upon to play a key role in. And we'll do our due diligence in monitoring our progress and success on achieving these national priorities for health. So I guess in sum, I'd say that as we look forward, PCORI's redoubling our longstanding commitment to accelerating diversity, equity, and inclusion efforts. We're really focusing on how we're going to make sure we are improving the care and outcomes for patients that are also traditionally or historically underserved by the healthcare system. And we're thinking about this strategic plan as a roadmap toward our vision, really that people have the information that they need to make the decisions that reflect their desired health outcomes and our mission to generate and disseminate that information through research and other initiatives that are guided by patients, caregivers, and the broader healthcare community.
Well, I am just so impressed with everything you shared, and I would encourage anyone who has not recently visited that strategic plan to do so now with the rich information that you provided us in terms of how that plan is being realized and how there's a place for all of us in contributing to that plan and certainly following the lead of you and your organization. Thank you so much for all that you do, your colleagues at PCORI are doing to advance patient engagement every day, and do so eloquently and effectively and in a way that I know brings true hope and meaning to all of us that have a stake, as you say, not just in a better healthcare system, but better health outcomes, a better health experience for all Americans. So thank you so much for that.
Thank you so much, Randy. It was a pleasure to be here with you today.